Good morning, everyone. This is Dr. Puru Dhawan, and as I promised, I am back with another exciting topic related to kidney health. Today, we will discuss how does chronic kidney disease leads to anemia. I will also explain in detail the step you can take to prevent it. Anemia, in simple language, is a condition in which an individual has a low count of red blood cells in the body. A low count of RBC can also be referred as a low hemoglobin. Hemoglobin is like transporter in the blood which is responsible for carrying oxygen from the respiratory organs to the rest of the body. Therefore, with less hemoglobin, an individual will not have a regulated oxygen supply to the other organ. Therefore, a low supply of oxygen would ultimately result in improper functioning of the specific organ. Red blood cells in an individual are produced in the bone marrow, and this process is known as erythropoiesis. Now the question arises why the level of hemoglobin are falling in a patient of CKD. Now for the formation of hemoglobin, body needs few elements like B12, folic acid, iron and erythropoietin. Now the body in a CKD patient have all these elements except erythropoietin. Body has B12, folic acid, iron, protein, everything except erythropoietin. Now the question arises why this erythropoietin is in deficiency in the body. Because in a normal individual, kidney are responsible for the formation of this hormone erythropoietin. When the kidney starts taking damage because of any reason, high BP, sugar, what happens? The formation of this hormone erythropoietin falls in the body. When there is less amount of erythropoietin in the body, the production of hemoglobin get hampered and resulting in the condition which is known as anemia. Now question arises how we can cope with this condition of anemia in a CKD patient. For improvement in the hemoglobin level, we have to give this erythropoietin hormone externally so that the body can form hemoglobin inside the body. The main symptom that points toward the anemia in a CKD patient are fatigue, dizziness, trouble sleeping as well as the pale skin and frequent headaches. There are more chances of developing anemia in later stage of chronic kidney disease. But in some cases, it can also develop at the early stages, which is worrisome. Therefore, if we want to prevent anemia and increase the growth of RBC, it is important for the production of erythropoietin to increase so that it can further stimulate growth in RBC cells. But unfortunately, there is no natural way to increase the growth of this hormone in a chronic kidney disease patient. But it becomes a necessity to increase the level of this hormone in a CKD patient. And hence, often such individuals are prescribed erythropoietin injection. This is done artificially so that the production of RBC can be increased. With this, it is also essential to make sure that the level of folic acid, vitamin B12 and iron should be maintained at the all time. At times, erythropoietin injections are not effective in some cases. In such cases, patients are given darbepoetin injection. I usually recommend my patient to treat anemia by adopting erythropoietin along with balanced diet, avoid smoking and drinking and following a healthy routine. Anemia is just one of the issues that kidney disease patient faces. There are many others that can be treated with the help of natural remedies, and my advice is to always take aid of them. Such health issues can become grave gradually, and an individual should not ignore even the smallest sign. Creatinine and urea levels should always be kept in control to avoid any complication, and a healthy diet should be consumed to enhance blood flow in the body. With this, we have come to the end of this video. I hope all of you could get a fair view of what is anemia and how a chronic kidney disease patient is more likely to develop it if proper care is not taken. With this, I have also elaborated on the way with which you can improve your situation if you are a kidney patient and you also suffering from the anemia. Apart from this, if you still have any query, I would request you to leave your comments in the section below and I would love to answer all of them. Till then, take care and see you.